Okay. According to the National Centers for Medicare and Medicaid Services, the United States spends $3.6 trillion per year on healthcare. That breaks down to nearly $11,000 per person. Healthcare is an extremely controversial topic that is currently on most Americans' radar. Nearly all Americans can agree that our current healthcare system is not working. But today I would like to review with you why universal healthcare, as Bernie Sanders would call it, Medicare for all, would not be a good solution for us at this time. As a licensed health insurance broker, I see firsthand the struggles that people experience as they deal with unexpected medical bills. Using journals and articles from the Kaiser Family Foundation, George Mason University, and more, I will take you through a few of the many reasons why we as a country are not prepared for universal health care. Universal health care would not be a good fit for the United States at this time due to an extreme increase in taxes, a decrease in quality of care, and a lack of ability by our recent administrations to administer health care. Let's begin with the extreme increases in taxes that would be required to support universal health care. A study completed by the Mercatus Center at George Mason University found that the proposed Medicare for All solution would increase federal spending on health care by $32 trillion. The study also found that by doubling our current projected federal income and corporate taxes, that we would still not be able to cover the increase to federal spending. According to the Kaiser Family Foundation, 97% of all healthcare expenditure in the United States is incurred by only 50% of the population. This means that moving to a single-payer healthcare system would greatly burden 50% of the population by only providing care to 50% of the population. Multiple plans are currently proposed to tackle American healthcare, and none of the current proposed plans include any cost share for the individual, meaning if someone were to fill a prescription, for example, they wouldn't have to pay for it. By not having any skin in the game, they are much more likely to seek services that they are currently putting off, meaning that these projected healthcare expenditures could be potentially significantly understated. Some countries, such as Switzerland, take a different approach than those being proposed, where they require all legally present residents to purchase insurance that is heavily regulated by the Swiss government. You can see here that would increase the per capita out of pocket. Currently, the United States spends $1,103 per year per capita out of pocket. The Swiss model increases that to $2,326 per person per year. More importantly than the increase of cost to Americans that they would experience under a single-payer health system, we would also experience a decrease to the quality of care that we currently receive. According to a study done by the Fraser Institute at the end of 2009, only 20.3% of drugs approved by Health Canada, which is their version of the FDA, had been approved for reimbursement by their healthcare system. This forces citizens to go outside of Canada, frequently coming to the United States healthcare system, to gain access to these drugs. The Fraser Foundation also reports that the median wait time to see a specialist in the Canadian healthcare system is 21.2 weeks. This is the wait time after receiving a referral from their general practitioner, which is required under their healthcare model. But not all specialties are created equally. The median wait time for a Canadian to see an orthopedic surgeon under the same study is 41.7 weeks, so it takes nearly an entire year to get in to see an orthopedic surgeon. Under a single-payer system, the salaries of medical professionals such as doctors and nurses will also be dictated by the government. This will result in lower salaries from as the government works to contain cost, and will discourage physicians and other professionals from moving into the medical field. While our current healthcare system does cost more, it affords us luxury access to care much faster and gives us more control over our healthcare, such as the ability to schedule an appointment with a specialist at any time of our choosing. A decrease in the quality of care under a government-run single-payer system can also be seen by analyzing the performance of current government-run healthcare systems, such as Medicare and the Veterans Health Administration, also known as the VA. In first looking at the current Medicare program, which Bernie Sanders intends to expand to cover all citizens, the Centers for Medicare and Medicaid report themselves in their 2018 Trustees Report that the Medicare Hospital Trust, which pays for Medicare Part A claims, which is hospital visits, they are only expected to be able to pay 100% of claims through the year 2026. At that point, the trust will be paying out more in claims than they will be collecting in funding. This is just another example that in order to run a single-payer health system, costs to the taxpayers will need to be increased. Much worse than the Medicare system is how the Veterans Health Administration is run. In 2014, 40 veterans were reported dying while waiting for care at a Phoenix VA hospital. In 2017, the Virginia Inspector General performed an audit on wait times at VA facilities and found that while the VA was reporting only 10% of veterans had to wait over 30 days to access care, this number was actually over 36%. With these findings, we can't trust the statistics that the VA is producing themselves. Furthermore, the government has proven that they are unable to effectively manage funding and budget appropriately. This is shown by their management of the building of the Rocky Mountain VA Hospital. Per information gathered by the Colorado Public Radio Association in 2006, the VA had estimated that the hospital would cost $537 million and would be open for business in 2013. Upon finally opening in the summer of 2018, so 5 years behind schedule, the VA hospital's final price tag was over $1.7 billion. This means that the project went more than $1 billion over budget. If we can't trust the government to accurately report on the care that they're providing to our veterans, or to even remotely properly budget for a hospital, how can we trust them to properly administer care to our entire nation? In considering a single-payer healthcare system, it is important that we think of extreme increases to our taxes, the decrease in quality of care, and a lack of ability by our recent administrations to be able to provide healthcare to programs that are already in place. While our current healthcare system is significantly broken, it would behoove us as a country to make sure that we fix it correctly the first time. The new system needs to be something that we as a country can afford, while also providing our citizens with access to quality care. Due to past experiences, we can see that our current government administration is not currently capable of running a healthcare system while adhering to a budget or providing members with quality care. Our country is at a very critical time in healthcare reform, and it is not black and white. This does not need to be a partisan issue, and it is time that we as Americans join together and make decisions on what is best for our country as a whole. A single-payer health system does not solve any of the problems currently faced by our current healthcare. I hope that you will stand up with me in our right to healthcare. Thank you.